Welcome to Illuminating Health, the UCSF School of Nursing's podcast that sheds light on health and healthcare issues affecting our daily lives. My name is Ali Siegel, current student in the BSN entry to Doctor of Nursing Practice pathway, Family Nurse Practitioner specialty, and today I'm joined by Lety, Wilke, and Judge. Lety and Katie are clinical nurse specialists at Stanford Healthcare's endocrinology clinic and current students in UCSF's postmaster's DNP pathway. Thank you both for joining today's episode.
Thank you.
Thank you. Thanks so much.
About 1 in 10 Americans have diabetes, a chronic condition that can lead to circulatory, renal, and nervous system disorders. The Hispanic population in the United States is disproportionately impacted by diabetes, with Hispanic individuals being 1.5 times more likely to die from diabetes than non-Hispanic whites. Lety and Katie are leading efforts to address this inequity by providing diabetes care and education in Spanish for Spanish-speaking patients at their endocrinology clinic. Lety and Katie, I'd love to hear what brought you to work in diabetes care and education. Lety, why don't we start with you?
So my interest in diabetes care is really multifaceted. I want to say that it started early in my life. I grew up seeing the impact of diabetes firsthand because my grandfather lived with diabetes and he eventually developed serious complications from it. And that left a lasting impression on me. And then later, when I was working as a bedside nurse in cardiac surgery, I saw just how many of our patients had diabetes. At the same time, I was also volunteering with Rotacare free clinics in Gilroy. A majority of our patients were farm workers, and many, or it feels like majority of the patients' visits were diabetes related. And it was usually patients who were symptomatic and were found to have really high blood sugars. And at that point, it became so clear to me that diabetes was at the center of so many serious health issues. And once I began working in endocrinology as a clinical nurse specialist, I also had the opportunity to work as a research nurse on various diabetes studies. And one study in particular had a huge effect on me. While seeing these participants at the dialysis clinics, I witnessed the rates of diabetes related end stage renal disease, limb amputations, and even blindness, and all complications that are largely preventable. And that really stayed with me. And I found it especially astonishing that so many of the patients in those dialysis clinics were people of color, which was a clear reminder of the health disparities that still exist even today. And so for me, it was all of those experiences together that really led me to specialize in diabetes and pursue a master's degree and become a clinical nurse specialist, and then get, certification as a certified diabetes care and education specialist. And obviously now with a strong focus on prevention, health equity, and empowering patients to control their health.
Wow, it sounds like you had some amazing experiences working with diabetes patients, starting with your own family. I can see how that could be so impactful and empower you to get into this kind of work. Katie, how about you?
Well, thanks, Allie. My journey into diabetes care began through my original work as a registered dietitian in a diabetes clinic, and I later went back to school for nursing at UCSF via the MEPIN program. There's so much intersection between the diet and diabetes medications, and I found that combining these two roles, the dietitian role and the nursing role, was very helpful in the world of helping to manage diabetes. I now work alongside my awesome colleague Leticia as a clinical nurse specialist at Stanford's endocrinology clinic, and we find very quickly that managing diabetes is really not just about medication. It's about the daily decisions people have to make, the emotional resilience, the sense of burnout that patients get. And I found myself wanting to support patients in more than, just managing their labs. You want them, Lety and I both want them to feel seen and feel heard and empowered. And as I started to work more with patients from diverse backgrounds, including many Spanish-speaking patients, I realized really how important culturally tailored care was to improving outcomes.
Yeah, I really like what you said about empowerment. I mean, we've definitely seen in practice that empowered patients just seem to have so much more success when they're making like the necessary changes to live their healthy lives. So, yeah, thank you for sharing that. Each UCSF DMP student completes a quality improvement project as part of their program. Lety, as your project, you led an interprofessional team to deliver diabetes care and education in Spanish to Spanish-speaking patients using a shared medical appointment model.
Yeah, and a lot of people aren't familiar with shared medical appointments because they're not as common. They're using them a lot for, chronic conditions. But basically, shared medical appointments are a group-based care model where multiple patients are seen together by an usually an interprofessional team in a collaborative setting. But yeah, the shared medical appointments are designed to make healthcare more efficient, give patients more time with their providers, and strengthen that engagement, especially for chronic conditions like diabetes. So what I did for my evidence-based quality improvement DNP project, I led the development of a shared medical appointment program designed specifically for Spanish-speaking adults with diabetes. And the idea was to create a space where patients could learn together in Spanish in a supportive environment, and they were encouraged to bring a family member or a friend along for support. The program offered three 90-minute sessions. Each were held once a month over a 3-month period. And each session was interactive and culturally tailored. It covered areas like really important areas such as healthy eating, monitoring blood sugars, medication education, and practical skills like, it ranged from like insulin injection, like a correct technique, to how to read food labels or plan meals, like well balanced meals, that are recommended for, you know, patients with diabetes. And so we structured the sessions around the Association of Diabetes Care and Education Specialist Self-Care Behaviors, the 7 self-care behaviors that are nationally recognized standards for diabetes management. In the interdisciplinary team of bilingual clinicians led the sessions, a clinical nurse specialist, that was me, and a registered dietitian, an endocrinology fellow, and a medical assistant. And we were all really supported by the clinic management as well as by a supervising endocrinologist that oversaw the entire program. So before each group session, every participant had a quick 10-minute one-on-one visit with me, checked in to review labs, go over medications, check vital signs, do a foot exam if they had not had one in the last year. We had space for 10 patients. 10 patients signed up, but we, did end up with eight patients that officially enrolled, which was, a good number because we had a really big room and, we ended up with like 16 people in total because every one of the patients brought a support person. So we had all our educational materials that were, that are provided in English. Everything was, translated by our medical interpreters into Spanish. So everything was really designed to be hands-on and highly relatable to participants' cultural backgrounds, including the foods, their daily practices, and cultural beliefs around diabetes. So, of the 8 participants who enrolled in the program, most of them completed all 3 sessions that were in person, but there was a couple that could not make it in person. So, they really still wanted to receive the education. So, I offered like a one on one telehealth, like a makeup educational session so that they can still get the education that they missed by not coming in person. And this also offered continuity of care. So that was also an addition that I had to do, to kind of accommodate the people that couldn't make it in person. So it was very flexible. Our goal was to really address the language and cultural gaps that traditional clinic visits often miss. Standard appointments are short and sometimes don't leave enough time for education. And especially not in another language. Like, for example, when a patient must use an interpreter to communicate with their providers, it takes up additional visit time. And so the visit time ends up being, a lot shorter for that reason.
That gives you really the ability to meet patients where they're at instead of just kind of expecting them to meet you as the clinician where you're at and, follow the rules that you set for them. It's kind of going into their world and determining what works for them. That's incredible. What impact do you think that this care model had for participants?
Yeah, and you're spot on about that because it's about meeting the patients where they are for sure. The impact of the program was really exciting to see. I mean, we were just excited the whole time we were doing this project because we were having fun with it as well. Like we were really, enjoying the camaraderie amongst us, and getting the feedback from the patients after every session was really like fulfilling. It was just really a great experience overall. But by offering the shared medical appointments in Spanish, we were able to deliver, comprehensive diabetes care in a way that was, culturally and linguistically meaningful for the patient. And at the end of the program, participants completed follow-up surveys to measure their satisfaction with diabetes treatment and self-efficacy in managing their diabetes. And the feedback was incredibly positive. We had them do pre surveys before they started the program, and then at the end of the third session, then they did the post surveys. We saw big improvements across the board. Participants' understanding of their diabetes treatment more than doubled, which was one of the most rewarding outcomes, because it showed that they really learned a lot just from coming to these classes or shared medical appointments, where they learned a lot about diabetes education. They also said that that overall the care felt more convenient and flexible to them. And all the patients mentioned they would recommend this type of program to others with diabetes. And on the self-efficacy side, participants reported feeling much more confident about everyday skills, the things that they have to think about every time, like choosing the right food, preventing how to prevent a low blood sugar, what to do when the sugar is high, like these things that otherwise they'd have to, go to the ER for, but, this time they're more aware, they're catching things early, they can do something about it before it becomes a bigger problem. But they also learned about having regular meal routines. The patients expressed that exercise was one of the things that they really were not, getting much of, and that they wanted to improve. So that was good to hear that after listening to the lecture on exercise, they were willing to make changes. But beyond the numbers, though, what really stood out were the open-ended comments. Participants shared that they learned things about nutrition and blood sugar management that they hadn't been taught before. Like they had never learned about this, despite them having diabetes for 10 years or 20 years. So that was really, really interesting and very rewarding to hear that. And also, they felt more connected to their care team, which was exactly the outcome we were hoping for. That sense of partnership and empowerment. It really shows that when you meet the patients where they are, in their language and in their cultural context, you can make a meaningful difference in their confidence and engagement in their own care. By offering this type of program, we were able to deliver comprehensive care in 3 sessions instead of like the patients having to come back for multiple times. And it was, for 90 minutes, but at the end of the visits, patients wanted to stay longer. So it showed that they were invested. Mm-hmm. And they really shared that they felt more confident, with managing their sugars at home. And it's really what we were, my team and I were hoping for.
Yeah, it sounds like that in this you really, kind of determined what the gaps normally are and we're able to address them and make them feel so safe and comfortable seeking care and asking questions from you guys. Katie, you're also a clinical nurse specialist at the same endocrinology clinic. What kind of impact has this project had for your clinic's patients and providers?
Thanks, Allie. Yeah, no, I mean, gosh, I think I could go on for a very long time about the impact of this project. I mean, honestly, Lety's project has made such an impact on our clinic. I mean, can you imagine, having a bilingual, bicultural provider deliver care in this and education in this group setting? I mean, it just really helped break down the language barriers and like as Lety was attesting to, I mean, it just made patients feel more comfortable and connected in so many ways that they don't often get in some of these short visits. And so this just really allowed for that to blossom. And for providers involved in it, it was also an amazing experience to see how more from their perspective, to see how more engaged patients were when they could participate in their own language and bring family members with them. And we received, this project also received feedback, and I was hearing from other physicians in our group and other providers that the patients themselves were showing up to the visits with a better understanding. They had questions prepared. They were ready. They felt engaged. So there was such a ripple effect to this type of a group, a group visit, and the shared visits. They shared it created a sense of community amongst patients, which can really help combat the isolation that sometimes patients feel, and the burnout that they feel when dealing with with dealing and trying to manage a chronic condition like diabetes. So I mean, it was just I can't speak enough about the positive impact of this project.
Letty, you mentioned the interprofessional team that you worked with on this project. How did having access to an interprofessional team benefit the patients?
When patients see their healthcare team working together for them in their language and on their terms, it truly empowers them to to take ownership of their care and to make changes. We notice, they become more engaged. Patients definitely are more involved in their care. They're asking questions. We notice their, no-show rates are dropping and glucose is improving. It's really amazing to see. And I honestly feel that having a bilingual and bicultural interprofessional team was such a key part of that. As part of the program's success, it really benefited the patients in several ways. First of all, it gave patients access to different specialists, like an advanced practice nurse, also diabetes educator, a registered dietitian, and an endocrinology fellow, all within one appointment, instead of having to schedule multiple visits on different days and waiting for referrals or, managing transportation for all these trips. They were able to get comprehensive care and education all in one place at one time. And I believe that was a huge advantage because for patients who rely on public transportation or have other barriers to, they have other barriers to multiple appointments. They have jobs, multiple jobs. They work long hours. And one of the patients actually mentioned that, she did rely on public transportation, but she never missed a visit because she wanted to be here. So that was really rewarding as well. But the interdisciplinary format also meant that patients got a more well-rounded perspective on managing their diabetes. For example, during a single session, they could learn about blood glucose monitoring from the clinical nurse specialist. They can ask questions about medications or side effects, with the endocrinology physician or the fellow. And then they immediately got practical nutrition advice from the dietitian, all woven together around the same topics that we were covering that day. Definitely, I think the collaboration really showed patients that managing diabetes isn't just about one piece, like just medication or just diet. It's about the whole picture. And having that bilingual team helped build trust, I believe. I mean, it definitely felt that way. And patients could see that each team member understood, they understood their language, their culture, and the real world challenges that they face, every single day. So overall, the interprofessional approach made the care more accessible, more connected, and more patient-centered. And it allowed us to model teamwork in a way that supported patients' confidence in managing their health.
Yeah, I mean, I think from the patient's perspective, when you have all these different care providers that are saying different things to you and just, giving you all these different ideas of what you can do, it can be really frustrating, especially when that's not in your native language. So having everyone on board speaking the same language, it feels like more of a team, and I think it can just make such a strong impact. Um, how do shared medical appointments benefit diabetes patients?
The one thing I can say is, shared medical appointments really help patients. I think, Letty, you pointed that out beautifully, that patients realize they're just not alone. Diabetes can be overwhelming. There's so many components to it. And then there's a lot of guilt and frustration and fear with all these changes in medications and, ways of checking your sugars. But when patients hear others share similar experiences, what they're going through, what family members are going through, it really changes that tone from one of isolation to one of community. And patients can ask each other questions like what they were seeing in these group visits, asking each other questions, exchanging tips, offering encouragement. All that's so important, and it gives providers involved in these group visits an opportunity to really deliver education in a way that's more interactive, it's more fun. It creates a whole new experience that providers are really watching their patients have, and you build on that. So it's a really, really amazing experience. And because these appointments included family members, educating the person who maybe contributing with helping with the meals or buying the buying food at the grocery store, having those people in the group visits, alongside the patient is really critical. And this type of support just makes such a difference.
Yeah, I think it's so important to name that, like, even when as a nurse or provider, you really wanna connect with the patient. We don't always have the same lived experience, or there's cultural, language barriers that our patients face, so it seems like it really helps having family members or community voices there in those shared appointments that can really help bridge that gap.
In our project, the model really offered diabetes patients a more, supportive experience because compared to a short clinic visit, they got to spend 90 minutes learning, asking questions, and engaging with a team of specialists, all in Spanish and in a meaningful way. They all got to hear from others facing similar challenges, which often sparked the conversations and learning that might not have happened during a regular one-on-one appointment. And that was really neat to see as well, where a patient had a question and then that started a whole conversation because it's, a question that otherwise would have not been, asked. Or the patients are probably wondering the same thing but didn't ask. So it was nice to have others asking questions and all learning from that. And it was really, really neat again to see the patients having conversations and giving each other advice. It was really cool. But one thing that's special about the model is that patients can bring a family member or a friend to learn with them. So they're coming to class also. For example, one of the participants brought his wife to the sessions because, she's the one who's primarily cooking and preparing the meals at home. So having her there made a huge difference for this patient because she was able to learn about, healthy meal planning and diabetes nutrition alongside the patient, which made it easier for them to make changes together. And so, we got to hear about it the next session, how they had made or incorporated these changes into their daily, meals. So overall, shared medical appointments help build knowledge, confidence, and community, which are all very critical for long-term success in managing diabetes.
Yeah, it's nice that other people can be there to bounce ideas off each other and come up with a plan together rather than, the patient feeling so isolated and making these changes. Katie, you mentioned the importance of community and knowing that you are not alone when navigating health conditions. As part of your DMP program, you led a quality improvement project to support mental health of patients with diabetes. Can you please tell us a little bit more about that project?
Sure. Yeah. Well, thanks. Yeah, my DMP project really focused on supporting the mental health of patients with type 2 diabetes. We know that, as we had mentioned earlier, one third of patients are living with diabetes. And, also a third of that are also experiencing a form of depression. And that untreated depression worsens glycemic control. And I implemented a screening protocol using the PHQ-2 and the PHQ-9, which is the Patient Health Questionnaire, to help identify and support patients experiencing depressive symptoms in our clinic. And I also trained the advanced practice providers, registered nurses, rooming staff on how to use these tools confidently and, most importantly, compassionately. And what we found was even short training increased providers' comforts with discussing mental health. And screening rates improved, and it tied directly to what we're already doing, helping patients manage their diabetes by recognizing that mental health is a significant part of their journey of living with diabetes.
Yeah, I really think addressing people's mental health is such an important part of managing any chronic condition. So thank you for sharing that. What advice do you have for our listeners who want to make healthcare more accessible, particularly for Spanish speaking patients?
Yeah, one of, I think Lety mentioned this earlier, but one of the most important things we can do is to meet patients where they are linguistically, culturally, emotionally, and that. That might be simple things. You can, like learning a few key phrases in Spanish and offering, and really offering interpreter services early during the visit and making the patient feel really, really welcome and comfortable in their own language, and ask them, does this meet their needs, and making sure there's educational materials available in their preferred language. And Letty mentioned this earlier, creating a space where patients feel safe to ask questions and share concerns, again, in their native tongue. And I've seen how much trust this builds when patients know that they're being truly understood. And the trust leads to better engagement, which leads to better outcomes and stronger partnerships. So small steps like, Lety said she adjusted making it, taking that visit that was gonna, they couldn't make it to the group visit, so she turned it into to a one-on-one. Well, that goes a long way. Adjusting appointments like that to accommodate work schedules, or including the family in the education, really, really goes a long way for that partnership. And accessibility starts with understanding, and I think what this program shows is empathy, and to get an idea of what patients are dealing with in managing a chronic condition like diabetes, on a day-to-day basis.
How about you, Lety?
One of the biggest pieces of advice I would offer is to really prioritize language accents and cultural humility in every part of the care process, because it's not enough to just have materials translated, which happens, all the time. It's really about making sure that education, communication, and even the overall experience feels welcoming, relatable, and respectful of patients' values and traditions. For Spanish speaking patients, having bilingual providers or interpreters is very valuable, but so is creating programs that truly reflect their lived experiences. And that could mean offering groups, education in Spanish, simply taking a few extra minutes to check that the patient is understanding, what you're saying, and that really helps build some trust. Another important thing is involving the patient's families whenever possible, because in many Latino cultures, family plays a really big role in healthcare decisions and just day to day support. So when you engage not just the patient, but the people around them, you're setting them up for success. And lastly, even small changes can make a big difference. If you advocate for more, culturally and linguistically appropriate services in your clinic or in your department, or even, like Katie said, in your individual interactions, you're moving the system toward a more equitable care. And it really starts with asking, how can I meet this patient where they are? And that mindset alone can open a lot of doors.
Thank you, Letty and Katie, for joining us on this episode of Illuminating Health, and thank you to our listeners. We look forward to connecting with you next time.